Hey guys, Dr. Angelina with Georgia Surgical Arts, and Ideal Body Institute. I am gonna talk about Brazilian butt lifts. I had a few requests, and it's both for male and female. What is Brazilian butt lift? You would think it's so common, so many people do it, but I still get a lot of people coming in. They're asking for something, they don't know what it's called, they want their booty bigger. And I say, okay, BBL, give a quote for BBL, and they're like, what's BBL? Like, I don't know what BBL is. I'm like, it's Brazilian butt lift. That's fat transfer. Brazilian butt lift is a fat transfer. Basically, we do liposuction and other parts of the body. Normally, it is liposuction 360. We take fat out from the abdomen, upper and lower belly, the flank area, maybe some back rolls. And we take that fat, we harvest it in the proper way, and we put it back into the booty. We can also put it in the breast or anywhere else in the body that's required, but most common place is butt. It can be done for male and women. Butt is a butt, everybody got one. I am more natural, meaning I don't do those huge booties. I try to go with the patient's natural body type. If somebody has very kind of athletic build, giving them that big side hips and big booty, it's gonna look funny. It's gonna be like a balloon on two sticks. So I really do try to kind of follow the natural curves and then just enhance what patient already have. A lot of people have athletic build, but they really don't like the hip dips, little natural dips in the hip. That's where your muscle contracts and creates this little kind of indentation. And some people don't like them and will like to fill them. So that's completely fine. Again, really following the natural body contour. Procedure takes few hours for most people, because if you're trying to make a sizable difference, like you're trying to see the difference, we'll have to harvest enough fat. And it goes with your body proportion. Obviously, if you're a bigger person, you'll have more fat for me to transfer. If you're a skinny person, we'll do skinny BBLs. So if you're only 130 pounds or 120 pounds, we can still find enough fat for most people to transfer it out. In my practice, I would never ever ask patient to gain weight, to make fat, to transfer the fat, and then they will lose the weight. Like, I don't do that. That doesn't make sense to me, because if you gain the weight and we transfer the fat and then you lose weight back to your baseline, then you basically gonna lose all the fat we just transferred. So I absolutely do not ask patients to do that. Another option for very skinny people for Brazilian butt lift is to use fillers. We have fillers. Most common we use on the butt is Radies. It's a calcium-based filler. We dilute it out with a lot of saline and then we inject it. Again, it's not meant to make this big booty. It's to plump it. It's to tighten the skin if it's starting to get saggy. It's to fill in those hip dips. But it takes, obviously, more than one syringe to do it. If somebody's planning to invest in that, they can try. It's relatively quick recovery. The biggest part of it is not the liposuction. It's the recovery from the butt part, because you're not allowed to sit on it for a few weeks. Bring that little booty pillow everywhere with you so you don't put too much pressure on your butt. You end up kind of either standing most of the time or kind of leaning onto things to really try to preserve the fat. Another thing I do in my practice, I put everybody into hyperbaric, that's oxygen chamber, on post-operative day 1 or 2. And that helps to kind of get that oxygenation to the tissues and to that new transferred fat, to allow the fat to really kind of grow roots and take and grow better. And there have been some studies that show that fat does remain intact longer after the transfer if you do hyperbaric chamber. What does that mean? Basically, most time you'll hear that when you do fat transfer, let's say I put 1,000 cc's of fat into the butt, normally only 50% of it will remain, 50% of it will melt over time. With techniques that we use, and we use Vaser for fat collection, we say 20% of fat will melt, 80% will remain. Well, to really ensure that, when I put you in oxygen chamber, the hyperbaric chamber, it really helps for that fat to survive. So we get better results. Brazilian butt lifts is for both men and women. It is really for anybody who wants to enhance their body. It's safe in the right hands. There have been a lot of data coming out saying that there were some deaths involved with the procedure. That's when people were placing fat into the muscle. Their vascular area and fat can actually get into the vessels and travel and cause a lot of respiratory problems, and basically you can't breathe. And there's some other medical issues that happen with it. So of course we try to avoid it. So there's a proper placement of the fat in the right amounts, in the right place that needs to take place. You have to make sure you go to the person who really knows how to do it right for safety purposes. So keep that in mind when you're looking for a doctor. You can always consult with me at Surgicare Arts Ideal Body Institute. We're located in Atlanta, and now we're coming to Tampa. And we can always do telemed appointment, which makes it easy and convenient and secure. And we can talk about your issues. Show me everything you have to show me, and I can make my recommendations. Hope that helps. Follow us on YouTube at Ideal Body Institute and on Facebook, Instagram at Surgicare Art. Thank you.